Limmer, and thank you all for coming this morning. There's an old phrase that says, when you're in a deep financial hole, stop digging. And as you know, Minnesota is in a $6 billion financial hole right now. And unfortunately, our new governor, Mark Dayton, who is a good man, he is not we're not here to say that he's a bad individual. We just simply think that he's wrong about his prescription for where Minnesota needs to go. Made a statement that I thought was fairly remarkable last week. He made a statement in the paper by saying, repeal of Obamacare would be catastrophic for the citizens of our state. He went on to say that he is seeking to expand Medicaid for an additional 95,000 Minnesotans and extend the deadline to apply for a $1 million health exchange grant, which our Health and Human Services Secretary suggested is in the works. Well, this is an extraordinary statement. The governor, in one of his very first acts as governor, when the state is in a $6 billion hole, seeks to put an additional 95,000 people in this state on the welfare system at a time when we're constrained to support those who are already on the system. And if he is doing it for the reason of applying for an additional $1 million grant, if you do the math, that means that each one of these recipients would be receiving about $10, a little bit more than $10. That wouldn't even pay for a morning's worth of health care for those 95,000 additional people on Medicare. This is an extraordinary move on the part of our new governor to have this be his opening signature statement to seek to add almost 100,000 new people to Minnesota's already overburdened welfare rolls. And so the reason that I'm here this morning with my colleagues from the Minnesota State Legislature is to call on Governor Dayton to heed his own advice. Because last week, when these same lawmakers put out plans to reduce spending and reduce the size of government here in Minnesota, as they wisely needed to do, Governor Dayton said that he wished that they would take their time. He also said the matter was marked by complexity and needed more time for talk. And this is the same governor who on the third day of office signed the executive order that expands Medicaid, Medi-Cal assistance, ensnaring the state in Obamacare, and will cost us millions upon millions of additional dollars that we don't have in Minnesota. All across the country, we're seeing Obamacare is driving up health care costs. Insurance premiums are rising. Bureaucrats are starting a process that will expand the list of minimum benefits insurance companies must offer, and that will raise the price of health insurance, and worse, it will take away consumer choice here in this state. Small businesses are fearing that these mandates and penalties of Obamacare will drive up their expenses. We're already seeing that happen with private insurance premiums, or make it impossible for small business owners to provide health coverage for workers, forcing them ultimately into government-run health care. I saw that when I did a tour of small restaurant owners who were busy trying to cull their rolls so they would have fewer than 50 employees on their employment records. Last week in Washington, our House of Representatives took a bipartisan vote to repeal Obamacare. At the same time, more than half the states in our country, 27, Iowa being the latest, are suing the federal government over the constitutionality of Obamacare. Very serious steps are being taken to stop this job-destroying legislation that will cause health care costs to rise exponentially. Yet here in this state, our governor, Governor Dayton, is unyielding in his desire to fully commit our state to it. In fact, he's wanting to make an already very difficult problem worse in this state by adding even more people to the welfare rolls. We're here this morning to call on Governor Dayton to change course. If Governor Dayton truly believes that cutting spending and shrinking the size of the government are complex issues, then how can he not at least withdraw his executive order? And that's what we're here to do this morning. We're calling on Governor Dayton to withdraw his executive order, sit down with these lawmakers who are only too willing to discuss with Governor Dayton what we can do to work this issue out, and work on the kind of bipartisan health care solution that will not add to our state's $6 billion deficit. Obamacare is already raising insurance premiums. It will raise taxes. It will raise taxes for people in Minnesota. It will gut the Medicare Advantage program, which many people in Minnesota take advantage of, and it will rob the people of our state of the choice to buy the kind of health insurance that is best for them and for their families. The time has come to fully repeal Obamacare, and we may need to take extraordinary actions together in order to see this happen in the next 2 years. And I yield back to Senator Limmer. I just want to add one more thing. With Obamacare, it's becoming more and more clear what we bought in this health care overhaul is one of the largest bureaucracies America will ever see. We have a chart that is, I apologize for how small the font is. It almost looks like the font in the tax code. But if you look at this healthcare chart, there are 1,950 new regulations that will have to be written under Obamacare. Now, if you consider 32 million new people will go into the healthcare system, but no new doctors, no new nurses, and only the financial resources that we already have. So what this means is we'll have to be spending trillions of dollars more for this system, but what we're really getting is not more health care, we're getting one of the largest bureaucracies that we will ever see in the United States. That's what we're buying in all of this. It will mean more hassle, more expense, but not necessarily more or better quality health care. We're on a collision course with reality right now, and that the reality is that the state's bank account is in the red. The same with the federal government's bank account. It's in the red. And so we're in no position to be able to afford to the expansive view of government with adding even more welfare programs, which is exactly what Governor Dayton is trying to do right now. We just took a historic vote last Wednesday in the House of Representatives to repeal Obamacare. There is no effort that I see afoot in the House of Representatives to fund Obamacare in any part or measure. So it's important for people in Minnesota to consider that right now Governor Dayton is wanting to commit Minnesota taxpayers to add even more welfare recipients to the welfare rolls at a very great cost, but it will be at a great cost for Minnesotans without necessarily money coming from the federal government to pay for those costs. This will be a very bad bargain for an already overburdened, overtaxed state.
Would you both then disagree with state level? Should they not even do the conformity to signal at any embrace at all of the federal health legislation?
Well, this provision in Obamacare, to be clear, goes up until a person reaches their 27th birthday. So a person is 27 years old and they can still remain on their parents' health insurance. That doesn't come without a cost. And if you look at the handout that we gave you, there's an answer on regarding the costs that are involved. It appears that it may be $300 a year in addition that will be added on to the cost of the parents' insurance policy. Also, I believe as a part of the response to that question, parents may not be able to opt out. They may be forced to put their child on. The other provision is that now in Minnesota, there are because of Obamacare and the high costs associated with it, no insurance company in Minnesota any longer offers any child-only policies. And it's because it would break the bank of the insurance companies to do so. And it's clear, all of these provisions that come in, they aren't free. They come at a cost. The question is, who will pay the cost? We know that the Minnesota legislature will be burdened with substantial increased costs, but so will the people that are paying the premiums now. In essence, the bottom line will be the people who are paying health care costs now will just be increasing their payments in the future. So the final result of Obamacare will be it will cost more and people will end up getting less. I mean, what a deal. This is why people are opposing Obamacare, because it costs more and you get less.
So should the state of Minnesota decline conformity on that specific portion?
I think that the legislature will make that decision about what they want to do. But my point here today is to say that this provision is not free. It comes at a cost. And I think we need to very carefully consider and think about what this means. We can do so much better than this. That's what we need to think bigger than this. We can do so much better if we adopt free market policies in healthcare, because the real problem here in healthcare are the cost drivers. And what we need to be able to do is attack the cost drivers. Obamacare has nothing to do with bringing down costs. It will not bring down costs. Again, if you read the handout that we gave you, clearly Obamacare is going to cost individuals and state legislatures substantial increases in money. Let's let science and technology lead the way in healthcare, and free market innovations in delivering quality of care. Government, I don't think it's any shock for anyone to realize that government is not the most efficient distributor of health care, and that's what Obamacare seeks to do.
Congresswoman, can we do one more? Congresswoman, in your comments earlier, it seemed like you said that you're going to take some type of action about this executive order. Maybe I misunderstood, but what type of action are you talking about? You're talking about legal action in courts? You're talking about action in Congress? What?
In the immediate, we're asking, you mean Governor Dayton's executive order? Yeah. In the immediate, we're asking Governor Dayton to withdraw that executive order. He does not have to go forward with it. We think it is a mistake. And in light of his comments last week, when this legislature, in an attempt to be responsible with the people's money, said, let's take time, let's sit down, let's talk about this, Governor Dayton wanted to tell the legislature to slow down on cutting government spending, and that's all we're saying is, Governor Dayton, slow down, be consistent in your remarks. If you think that we should be careful and be deliberate about talking, then I think it would be prudent for the governor to sit down with both House and Senate and talk about how they can truly have a responsible budget.
It sounded like you were saying that you or somebody need to take action beyond that.
Extraordinary action was the term you used.
Yeah, so what type of action are you talking about besides asking him to do something? That's a little action. What's extraordinary coming up? What do you expect?
Well, the legislature will have to make decisions about the budget because they are under the requirement to balance the budget. And if Governor Dayton wants to continue to put a priority on adding to an already expansive welfare role, that will make decisions very difficult for my colleagues who stand behind me, because they'll have to find cuts elsewhere. And again, Minnesota is one of the top, if not the top, state in the nation for offering welfare benefits. To expand that even more then takes away options from the legislature to balance their budget. And that's
you're not talking about lawsuits or anything? Right?
That may be a possibility in the future, but right now I think it would be prudent if Governor Dayton would put a hold on his executive order on early implementation in Minnesota, because of what Senator Limmer had stated. Only 2 states in the nation have decided to go with early implementation. Minnesota is in a very difficult place, being $6 billion in the hole right now in the red. And so to make the problem worse doesn't seem like a prudent move on the part of the governor.
So the bottom line is your message is the same as it was a week and a half ago to the governor.